Taylor with the City of Carbondale, Illinois.
I'm Chris Wallace with the City of Carbondale.
And I am Michelle McLernan with the Jackson County Health Department.
And we're here representing the Jackson County Healthy Communities Coalition. We are one of the second cohorts for the Plan4Health grant project. For our grant, we had several CAP initiatives. We decided to look into physical activity and healthy foods both, and had several different CAP initiatives which hit on several of these points. City of Carbondale planning staff partnered with the Jackson County Health Department to achieve most of these goals under the umbrella of the Jackson County Healthy Communities Coalition. Carbondale, Illinois, a little bit of background. We're set in rural southern Illinois. You can see on the slide here there are several pictures that kind of depict exactly what we're looking at and where we're at. City of Carbondale is the only professional planning staff for, I'd say, about, you travel an hour in all directions. We are the only professional planning staff in our area.
So Carbondale, Illinois is the hub. It's the economic hub. It's the healthcare hub of southern Illinois. It's probably the biggest urban center that we have. Through Carbondale and through Jackson County, we have had a long-standing coalition called the Jackson County Healthy Communities Coalition. We have multiple sectors that are dedicated to making sure that we have health systems in place. And because we had this long-standing coalition, we came in as implementation ready. We were in a perfect situation in which to develop a robust and ambitious program to tackle limited access to both nutrition and physical activity by blending both the sectors of public health and planning. Plan4Health allowed us to have resources and gave us a little boost to merge our programming to have a lasting and equitable impact on our communities. The Jackson County Healthy Communities Coalition is actually part of a broader network. This network was created a few years after the coalition started because there was a recognition that we needed to reach out and strengthen our network because we are in such a rural community. And the whole purpose of that was to maximize the resources that are available within southern Illinois without duplicating efforts. The coalition is comprised of many different sectors in the community, including churches and schools, both primary, secondary, and higher education. The healthcare systems are engaged in the coalition. Local health department also is an active member. We've got members of government, including the planning staff here in the City of Carbondale. And many service agencies and business leaders work together across sectors to try and engage in activities and initiatives, whether it's from a policy systems and environmental stance, also looking at health equity to make sure that we have the healthiest communities that we can have in our county. We meet every other month, and we have report outs from the various committees that actually reflect the health priorities that have been established in the community.
So a brief background on how public health and planning came to kind of integrate and start working together. The Jackson County Healthy Communities Coalition was started in 2003. The City of Carbondale has always had a seat on that commission. In 2008, they became a part of the larger Delta network. In 2010, the City of Carbondale began some of its replanning processes. We actually adopted our Carbondale Comprehensive Plan. And in 2012, the Southern Illinois Metropolitan Planning Organization came into existence as the Carbondale area and surrounding areas became recognized as an urbanized area. In 2012 and 2014, the Jackson County Health Department received community transformation funding. And then in 2014, the City of Carbondale and Jackson County Health Department both had seats on the Built Environment Action Team. In 2015, we received our Plan4Health funding, and this actually brought Jackson County and the City of Carbondale together more as we began to sit down and discuss how we can further integrate our day-to-day activities and consider each other's priorities. In 2016, you can see the City of Carbondale has been involved with a lot of different planning processes. all of which the Jackson County Health Department has had a seat at, the Carbondale Downtown Master Plan, the Carbondale Bicycle Master Plan, and then we also applied for and received bicycle-friendly designations as a result of some of our work. So, I'd say one of our largest gains from this process has been that with the Jackson County Health Department and the City of Carbondale planning staff sitting at the same table, we have learned to speak the same language and have learned to identify areas which affect the other party. We also are sharing similar terminology and also learning to have the similar mindsets. One of these examples came up when the Jackson County Health Department approached the City of Carbondale to install a bench. It was located, if I recall, in public right-of-way, and we were in discussions of that bench, and Jackson County brought forth the bench to us and discovered some of the problems that may come with that installation. And Michelle, if you'd like to step in.
Yeah, actually what we had to do was learn the priorities that each of our sectors have. So what the public health folks have to understand is that there's actually codes and regulations. It's not just suggestions. It's actually something that was set for very good reasons, valid reasons, whether it's economic development, it doesn't really matter. We had to learn what those codes were, and what we discovered was you can't just put big names on benches that come from a corporation, even if it's donated, and put it out there, because that puts the city in a tough spot where everybody thinks they could put a bench with their own name and there's no regulations. They could use whatever colors they want, and we realized that you can't just do that. So through some negotiation and compromise and trying to identify a site where this bench could be placed, we discovered that we actually can speak the same language. We can get to the same outcome that we had hoped to get to, and we found a site that was actually more optimal than what we had originally intended. So it actually was a happy accident that we discovered that sometimes we're not on the same page, but by negotiating to get on the same page, we actually have a better outcome. So the bench now is located near the library, which is near the hospital, because they actually got this from, they had won it at a rural planning workshop that we had hosted, and it's ideally.
Other lessons learned is that being where we are and where we're located, the City of Carbondale is unique in that we are, the only community around us with a professional planning staff. And so one of the struggles that we had is getting rural communities to buy in on the idea of integrating planning and health priorities. And that is getting community leaders to think about planning. And that kind of culminated in a rural planning workshop that we held later on in our grant process, where we were able to share planning ideologies and planning priorities with these communities, as we were able to it was kind of our final big event.
So when we're looking back with all of the successes we have, and we're about to address those successes, you know, some of the challenges that we faced actually taught us to work together better. It just reinforced that the collaboration is the best way to go, that we're going to learn and grow and understand, change and compromise and advocate for our communities through these collaborations and the compromises that we make. And adding these learning moments to our list of successes made our experience with the Plan4Health initiative even that much more rewarding.
You'll see here first on the side, and on the right picture on the slide, is our downtown temporary skating rink. The City of Carbondale works to work with a local developer and get their acrylic skating rink located in one of our downtown parking lots. The Jackson County Health Department came in on that and decided that it was a great idea to promote activity for our youth, and we brought two youth-based organizations, the Boys and Girls Club and the I Can Read organization, to that built environment change to show them that you know, what can happen in our downtown. It was a good activity for our youth and a good example of providing health equity. This is kind of the springboard for some of our other celebration of built environment improvements. We celebrated and had ribbon cuttings for bike racks, bike paths, and repair stations that we were able to repair stations and bike racks that we were able to install with the Plan4Health funds. We also worked with the Murfreesboro High School to develop this Murfreesboro bicycle rack you can see in the lower left-hand portion of the screen. The Murfreesboro High School has a metalsmithing class, and we worked with them. Jackson County Health Department actually discussed it internally and decided that they had connections at the high school and talked to them about possibly building a bike rack and installing it on their site. This event worked out great as they had a local bike club that was able to come out and celebrate the new addition. And then finally, it culminated with our rural planning workshop. Again, I kind of discussed at the beginning, this is where we shared planning practices and other resources to our local communities and pushed them to think about planning as they continue to develop for pedestrian and vehicle traffic.
One of the neat things, and I'm just going to go back real quick to the rural planning workshop, it's still there, Travis, it's okay, with the rural planning workshop is that it actually put the planning people, the people in the small communities who aren't trained planners, but they do planning to the best of their ability, and the people from the public health sector in the same room, and it built relationships just by having that one half-day event, which would show some sustainable programming. I mean, they're going to go back and they're going to have conversations, and the city of Carbondale was kind enough to extend support to them beyond the workshop. So if they have questions, they need some expertise in an area that they don't have, the City of Carbondale planners are willing to do that. And so everybody left, and we had some really good outcomes with the evaluation, feeling empowered that they can make some changes in their community and feeling inspired to do so. The other initiative, one of the other initiatives that we did was the farmers market and convenience stores. We were looking at healthy nutrition in our communities, particularly in the rural communities. We have a very vibrant and long-standing farmers market in Carbondale, which had actually not had EBT capabilities built into their system. So we were in the process of negotiating that with them, and with the Plan4Health funding and the resources that allowed, we were able to negotiate with the farmers market, with some of the vendors there, and create a really robust EBT program. And we were able to bring people from the community, from parts of the community that normally wouldn't go to farmers markets, out to access healthy, locally produced foods. What we also did was we tapped in with some of our coalition partners, and there was a double value coupon grant that we received. And for the month of October and November, for those 2 months, the individuals who came with their SNAP benefits and wanted to use them at the farmers market actually got the double value. So if they had gotten $10 worth of food off of their SNAP benefits, they would actually get $20 worth of tokens to use at the farmers market. And the preliminary data that we're looking at showed that it actually doubled, not just doubled what they got, but the number of people that were coming out. And this is with really limited marketing. So it was a huge success story. And one of the benefits that came from that was the farmers market that was just doing this as a pilot is so engaged with us now that this will continue into the future as a permanent resource for these lower income communities. The convenience store project was actually a pilot project that we did at a rural convenience store here in Jackson County. And it happens to be the hub. It's the economic hub. It's a social hub for the community. And they, as with most convenience stores, they didn't offer healthy foods. In fact, we would probably call them slightly unhealthy foods that you tend to get at these convenience stores. The owner happened to be really excited about trying this out and seeing what they could do. So we were looking again through the policy systems and environmental strategies, what we could do to incorporate some healthier foods. And the very first thing that they did was introduce a couple healthy sandwiches on their menu, and they sold out right away. So again, the partners that were newly established there with the convenience store got so excited. Again, the revenue was where they wanted it to be. The community was engaged and interested in continuing on, that they're going to go ahead and change their menu. They're putting signage up in the store. They're looking at even some joint purchase agreements, kind of using the economy of scale model, so that they can actually buy the kinds of foods and the quantities that they can support at the convenience store so that they can have some healthier options for the community. The very last thing that we did, well, we actually did so many things it's really hard to focus on, but we had a worksite wellness forum, and a whole bunch of people from not just Jackson County but the region came and attended that. In fact, we're going to do another one this year because this one was so successful. But probably the biggest outcome that came from that through the Plan4Health funding is the creation of the Worksite Wellness Starter Kit. Some of these businesses aren't quite sure how to get started. They're maybe not quite ready to get started, but with the Starter Kit, they have some resources available, some suggestions for some easy changes in the built environments and some of the policies, and even some of the systems within their own work site that they can incorporate some wellness activities for their employees. And then the other thing that was created, and Travis can attest to this, is the Rural Planning Playbook.
Yeah, the Rural Planning Playbook was created as kind of the literature to accompany our Rural Planning Workshop. It's kind of in the same vein as the Worksite Wellness Starter Kit. It explains planning best practices and shares resources with those communities that were in attendance. Throughout this whole process, we were very fortunate to get an extensive amount of media coverage, which I feel brought to light the challenges and successes of the partnership between planning and the health department. And we were also able to strengthen and expand our coalition. And you can see on this next slide, on the left, we have our existing partners prior to Plan4Health, and then throughout this process, we were actually able to establish some new partners through these conversations that we began having. And again, the real success and real strength of this process has been bringing everyone to the table and being able to share ideas and understand actually who you should bring to the table. And we really, I feel, step away from this knowing that we both know that each other, we are great resources for each other, and great, and health and planning always, I mean, they're in the same room and have the same goals.
So on that note, we want to thank you so much. If you want to communicate with any of us, please, on the last slide you'll notice that our contact information is there. We're really excited about it. We were only able to touch on a few things that we did. If we could talk for hours about the things that we did, we have resources that are available. You can go to the hsidn.org website. You'll see some of the resources, but I think they're also available through the Plan4Health page.